Start. Welcome back guys. Now let's continue with the sensory homunculus. So what exactly is this sensory homunculus? See, sensory homunculus meaning it's a representation of the body parts over the somatosensory cortex. Simple. It's a representation of different body parts over the somatosensory cortex. For example, look at here. Say this is your somatosensory cortex, the area that I am highlighting. This is your somatosensory cortex. Now you will be having a problem with the orientation. Let me show you. Guys, now what am I doing is I am going to take a cross section at this area in the somatosensory cortex. Okay, in the somatosensory cortex, I am taking a cross section like this and I am showing you from the front side. Okay, I am showing you from the front side. So now how the somatosensory cortex is going to look like? See, this is how it is going to look like. But still you are having a problem. Okay, let me give you a better understanding. See, now you will understand. So now you can understand these are the two cerebral hemispheres, okay, right and left. Now I am only showing the left cerebral hemisphere, and that too where I have taken the cross section, that the cross section that I have taken at the somatosensory cortex. So this area that I am showing, this is the somatosensory cortex. That's the first thing that you should remember. This is the somatosensory cortex. Now what am I representing? See, let's say in this area of the somatosensory cortex, okay, here I am representing a genital. What does I mean by? Which means this area of the somatosensory cortex, it is receiving the sensation from which part of the body? It is receiving the sensation from the genitals. So if you are going to stimulate the genital region, okay, if someone is coming and touching the genital region, or if any stimulation is going on the genital region, so where that sensations will come? All the sensations will come to this part of the somatosensory cortex. So you are going to feel the sensations in this part of the somatosensory cortex. Okay, actually you will feel like, okay, sir, I can feel the sensation in the genitals, but actually where you are, there is a stimulation in the genital, but actual sensation that you feel is that's happening in the somatosensory cortex. So this is the part of the somatosensory cortex where you are feeling the sensation from the genitals. Now in the same way, let's say this part of the somatosensory cortex is receiving the sensation from where? It is receiving the sensation from the hand region. And this part of the somatosensory cortex, in this area of the somatosensory cortex, the sensations are coming from the face. So what I am trying to say, the sensations are felt not on the skin. The sensations are not felt at the receptor level. The sensations, every sensation from the body is felt in the somatosensory cortex. So from today, if someone is coming and touching you, you are not feeling it in the skin. You are feeling it actually in the somatosensory cortex. But brain will make you believe, the somatosensory cortex will make you believe that the sensations are felt at the receptor level. Okay, that is called as a law of projection, that we will discuss later. But for now, whenever someone comes and touches you, the sensations, okay, will travel with the help of first order neuron, second order neuron, third order neuron. All the sensations are going to the somatosensory cortex, and it is the somatosensory cortex where you are going to feel the sensations. Okay. Now, see, when I ask you to draw a person, okay, just a rough diagram, okay, of a person, how you are going to draw? First, you are going to show the head, neck, upper limbs and lower limbs, something like this. So you are going to represent a person like in an upright position. This is how a person should be. But if you look at the this sensory homunculus, see, first I am showing the lower parts of the body. Later, I am describing the upper parts of the body. So I am representing a person something like this. First the lower parts and later the upper parts, something like this. So it's not an upright position, it's an inverted position. So it is upside down representation of the body parts, over the somatosensory cortex. So first which areas are coming? First the lower limb areas are coming. Later we are talking about the upper limbs as well as the head and neck and face. So that's the reason why here I have written it's the upside down representation of the body over the somatosensory cortex. And look at the definition. See, sensory homunculus represents mapping of the brain areas. We are mapping the brain areas. Dedicated for what? Dedicated for sensory processing for different anatomical divisions of the body. So you can say, sir, this area for the genital, this area for the lower limbs, this area for the hand, this area for the face, this area for the lips, this area for the chin, something like that. Okay, so it's mapping of the brain areas. Now, why you should know this as a doctor? See, always remember, guys, the medial part of the somatosensory cortex, if you see, this is the medial part, right? That's the center. Okay, the medial part of the somatosensory cortex, it is receiving sensations from which part of the body? It is receiving the sensation from the lower parts of the body, genitals, lower limbs, hips, trunk, this region. Okay, but the lateral part of the somatosensory cortex, is receiving the sensations from the upper part of the body, head and neck, face also. So first write that point. Medial part, okay, medial somatosensory cortex, medial part of the somatosensory cortex, receiving the sensations from where? From lower parts of the body. and lateral somatosensory cortex receives the sensations from upper parts of the body. Okay, upper parts of the body, head and neck, face, everything. Okay. Now, okay, sir. But why this is important for me as a doctor is because, see, let's integrate it with the anatomy. See this medial part of the somatosensory cortex, this area. The medial part of the somatosensory cortex, it is receiving the blood supply from anterior cerebral artery. Okay, the anterior cerebral artery is going to supply the blood to this medial part of the somatosensory cortex. And there is one more blood vessel, the middle cerebral artery. The middle cerebral artery, it is supplying the blood to the lateral part of the somatosensory cortex. Okay, to the lateral part of the somatosensory cortex. Now you tell me, if there is any block to the anterior cerebral artery, okay, ACA stroke, sir, ACA thrombosis. Whenever the anterior cerebral artery is blocked, so which area of the brain is going to be affected? It's the medial part of the somatosensory cortex is going to be affected. So now tell me, when the medial part of the somatosensory cortex is affected, so that area is dead, that area is dead. Now there is a stroke. So you cannot feel any sensation from the lower part of the body, gone, lower limb sensations gone. Okay, lower limb sensations will be gone on the opposite side, because you know this is the left somatosensory cortex. Left somatosensory cortex is going to receive the sensation from the right side of the body. If my left somatosensory cortex is affected, if I am going to lose the sensations on the right side of the body, because you know all the sensation from the right side is going to cross to the left side. All the general sensations as well as the advanced sensations. So you know, you tell me, if the medial, now tell me, if the medial part of the somatosensory cortex, if it is affected, the patient is going to lose the sensations on the lower part of the body on the opposite side. Okay. Now in the same way, when MCA artery is blocked, MCA stroke, what will happen? It's the lateral part of the somatosensory cortex is going to be affected. Lateral somatosensory cortex gone. When the lateral somatosensory cortex is gone, the person is going to lose the sensations from the head and neck region as well as the upper limb region. Okay. So now write that info. Middle cerebral artery, it's having a stroke. What will happen? If the middle cerebral artery is blocked, the patient will lose sensations from loss of senses from middle cerebral artery, from upper parts of the body. Okay. ACA stroke, anterior cerebral artery stroke. When the anterior cerebral artery, if it is blocked, the person will lose the sensation from lower parts of the body. Okay, lower part of the body as well as the genitals. Okay, so these are the important points which I want you to know as a doctor. So if a patient, if you ever see a patient who is complaining that I lose the sensations in the upper parts of the body. Okay, let's say I have lost the sensation from the upper part of the body on the right side. So where is the lesion? The lesion is on the left somatosensory cortex, that too on the lateral part of the somatosensory cortex. When the left lateral somatosensory cortex is affected, then the patient is going to lose the sensation from the upper part of the body on the opposite side. Okay, so this is that's the reason why you should know. Okay, based on the symptoms, based on the clinical presentation, you can actually tell where exactly is the site of lesion in the brain. Okay, next, what else you should know for your exam? See, I can say something like this: God shows some partiality. Okay, what is the partiality, sir, here? See, when compared to the entire body, you tell me how much is my hand size. My hand is going to be very small. Okay, my hand size is very small, right? But see, there is a very big part of somatosensory cortex. A very big part of the somatosensory cortex is receiving the sensation from the hand region. Let's say from here to here. So this entire area, this large part of the somatosensory cortex is just given for sensory processing from the hand. And when compared to the entire body, you tell me how much my face is. My face is very small when compared to the entire body area. My face area is very small. But see, face is receiving a very large part of the somatosensory cortex. A very big area of somatosensory cortex is receiving the sensation from the face. A very big part of the somatosensory cortex is receiving the sensation from the hand. So that's why I am representing the body parts in different sizes. See, I have shown here a big face, a big hand. Why? Because a big part of somatosensory cortex is involved. But you tell me, when compared to my entire body, what is the size of my trunk region, hips region, thigh region and the legs region? It's very big size, right? The trunk, hips and the lower limbs are comparatively bigger size. But see, God gave a very small region. A very small part of somatosensory cortex is receiving the entire sensation from the lower parts of the body. Okay. So, yeah, there is some partiality, the representation wise. See, I am representing the body parts, okay, but that too, some regions are having a big representation and some regions are having very least representation. So, that is the question. Maximum representation is given for, the maximum representation is given for hand, even the hand, thumb. Okay, thumb is having the maximum area, and face, even in the face, lips get the maximum area. That is why you can see here a big lips, okay, a big thumb. Next, least representation is given for, okay, trunk and hips. Okay, trunk and hip region is having the least representation. So, these are the important points which I want you to know regarding the sensory homunculus. So, sensory homunculus is the representation of the body parts over the somatosensory cortex. See, just like somatosensory homunculus, there is also a motor homunculus. Motor homunculus meaning different parts of the motor cortex. Let's say different parts of the motor cortex is going to control different parts of the body. Is going to control different parts of the body. That will be the motor homunculus. So, just like sensory homunculus, just remember there is also a motor homunculus. For now, sensory homunculus we have completed. Okay. Now, let me give you an example. Let's say, now today with an electrode, okay, what I am doing with an electrode, I am taking an electrode, I am just opening your skull, okay, I am just opening your cranial bones. Now, I am directly looking at your somatosensory cortex, okay, let's say I am opening a skull and looking at somatosensory cortex. Now, with this electrode, I am stimulating this part of the somatosensory cortex. Tell me what will happen. If I am stimulating, see, I am not damaging, I am just giving the electrical stimulation. If I stimulate this part of the somatosensory cortex, now what will happen? You will automatically start to feel the sensation in your hand region. Automatically, you will start to feel that, sir, someone, like, I can feel that someone is touching my hand, but actually no one is touching your hand. So, sensations are not felt here. The sensations are felt in the somatosensory cortex. If your hand area is activated, you automatically feel the sensations in the hand. Now, let's say today I am stimulating this part of the somatosensory cortex. Okay, I am stimulating this area of your somatosensory cortex. So, tell me where you will feel the sensation. You are going to feel the sensations in your face region. You will feel like someone is touching your face, but actually, anyone touching your face, no one is touching your face, but you will start to feel like that because the face area is activated. So, this is the law of projection that I will explain in the next video. Okay, so these are the areas of these are the areas of the somatosensory cortex where you are feeling the sensation from different parts of the body. Okay, so with this, we are completing the topic of sensory homunculus. In the next video, we will be discussing about the law of projection and phantom limb phenomena. Hope the video is helpful. Thank you.